Hello everyone, welcome back to our channel. I'm Dr. Ashmita. Today, let us discuss about hepatitis. In this video, we shall discuss a brief overview of hepatitis. Hepatitis, the term hepatitis itself, what can you derive from hepatitis? When you divide the term, hepar means liver, itis means inflammation. So hepar is liver and itis means inflammation. Therefore, hepatitis is defined as it is the inflammation of the liver parenchyma. So before we discuss about the characteristics of hepatitis, we shall have a brief understanding about histology of a classic hepatic lobule. This classic hepatic lobule histology I have discussed in detail in my previous video on liver histology. For those who haven't watched the video, please go back to that video and watch it. So in the description the link has been provided. It will help in better understanding of the pathogenesis and the histopathology of hepatitis. In this video, I'll tell in brief about the histology of hepatic lobule. So, the classic lobule, it is roughly hexagonal in shape. This is the hexagonal shape with to the center there's a central vein, and each corner of the hexagon it contains a portal triad with hepatic artery. This is the hepatic artery. This is the bile duct. This is the portal vein. Apart from this portal triad, there's a lymphatic channel to the each corner. So the hepatic artery, portal vein, and the bile duct make up the portal triad. Along with the portal triad, a lymphatic channel is also present, and these are present to each corner of this hexagon, the hexagonal hepatic lobule. And the center, there's a central vein. And there is a vascular sinusoid and hepatocytes. They are present in hepatic plates in the form of a single strands. These strands are called hepatic plates. The space in between, this is space in between the sinusoid and the hepatocytes. This is called the space of Deci. Space of Deci. This vascular sinusoids, they contain macrophages called the Kupffer cells. Kupffer cells are present in the vascular sinusoids. The space of Deci contains Ito cells. Ito cells, also called the stellate cells, which are the vitamin A storing cells. In under special circumstances, these Ito cells transform into myofibroblast. They transform into myofibroblast and produce collagen, which get deposited, and this is responsible for the fibrosis. This is in brief about the histology of a classic hepatic lobule. Coming back to the definition, this inflammation of the liver parenchyma, it is characterized by a spectrum. It is a spectrum of hepatocellular injury. And this hepatocellular injury can be characterized by hepatocyte degeneration. Degeneration means it is a reversible disease. It is a reversible cell injury in the form of ballooning or the hydropic change. So consider this as a normal hepatocyte which is roughly polyhedral or polygonal in shape with central round nucleus. The cytoplasm is granular. It is eosinophilic and granular cytoplasm. So the normal hepatocyte, polygonal in shape with a central round nucleus, cytoplasm is granular and eosinophilic. When the cell gets swollen, it becomes large, it loses its normal polyhedral shape, it becomes large in size, nucleus gets displaced, nucleus gets displaced, and the cytoplasm becomes pale. It becomes pale eosinophilic and it may become vacuolated. There can be vacuoles in the cytoplasm. This is the hydropic change. This is the hydropic change of a hepatocyte. The normal hepatocyte has this pump called on the membrane. Sodium and potassium pump is present on the cell membrane one of a normal hepatocyte. When this membrane gets damaged, this pump failure occurs. Because of pump failure, sodium along with sodium water retention occurs, sodium water retention occurs, because of which the hepatocyte appears swollen. Hepatocyte appears swollen because of sodium water retention due to sodium and potassium pump failure. That is the reason for this Hepatocyte swelling, when it is in severe swelling, it appears like a balloon. This vacuolated cytoplasm and severe swelling appears like a ballooned hepatocytes. Hence, it is called ballooning degeneration or hydropic change. And the cell injury can also be in the form of necrosis. It can be in the form of necrosis, which is a form of cell death. The cell death can be spotty, confluent, bridging, or massive. Spotty means, for example, you consider this classic hepatic lobule. In this, the hepatocytes are present in the form of strands. These are the strands of hepatocytes, which are called the hepatic plates. So, the necrosis of a single hepatocyte is scattered. Here, I'm doing this. This is the necrosed hepatocyte. So necrosis of scattered or single hepatocyte. This is called a spotty necrosis. If at all, this occurs in groups, in clusters. If there's a cluster of hepatocytes affected, this one cluster, then it is called a confluent. This is called a confluent necrosis. Confluent means cluster of hepatocytic necrosis. This is single. This single is called the spotty necrosis. So it can be a single scattered hepatocyte necrosis, which is called spotty necrosis, or it can occur in groups or clusters of hepatocyte, that is called confluent necrosis. If at all, consider this hepatic strands. If this necrosis is occurring in between these two portal triads, that is called a portal necrosis, or if it occurs between this one portal tract to other portal to the central vein, between the central vein, for example, from the central vein to this portal tract. This is called a portal central necrosis. So from here, if the necrosis occurs from from here, this area, from one portal to one portal, that is portal necrosis, or if the necrosis occurring between the central vein to this portal tract, that is the set of hepatocytes between the central vein to the portal tract, that is called a portal central necrosis. If a group of hepatocytes between two portal tracts gets affected, that is called portal necrosis, or a group of hepatocytes between two central veins of the adjacent hepatic lobule. This set of hepatocytes between two central veins, that is called a central necrosis. These three are called the bridging necrosis. These three are called the bridging necrosis. Or it can be a massive necrosis. Massive means more than the bridging necrosis. Extensive form of necrosis is the massive necrosis. And there can be inflammatory cell infiltrate. The inflammatory cell infiltrate can be because of underlying infection. Because of underlying infection, the inflammatory cell infiltrate can get recruited, or it can also be due to this necrosis. The inflammatory cells include the lymphocytes, the plasma cells, and macrophages. Predominantly, lymphocytes are present. Also, plasma cells and macrophages are present. Neutrophils are rare, but neutrophils are seen in secondary bacterial infections. Eosinophils are extremely rare. And in chronic cases, there can be fibrosis. In chronic cases, this fibrosis occurs because of TGF-beta. TGF-beta is the transforming growth factor beta secreted by these ito cells. Under special circumstances, the ito cells present in the space of disease, they act like myofibroblast. They secrete transforming growth factor beta. The TGF-beta is responsible for the fibrosis seen in chronic cases. So let us summarize. Hepatitis means, from the name, hepar means liver, itis means inflammation. Therefore, it is the inflammation of the liver parenchyma. It is characterized by point number one, hepatocyte degeneration in the form of ballooning, that is the swollen up. Normal hepatocytes, they are like roughly polyhedral with eosinophilic cytoplasm, central round nucleus. When sodium potassium pump failure occurs, the hepatocyte becomes swollen, the cytoplasm becomes pale, and it may contain vacuoles. This is called the ballooning degeneration or the hydropic change. Number two is necrosis, a form of cell death which can be spotty, means a single scattered hepatocyte necrosis can occur. It is spotty, or a group or a cluster of hepatocytes can be affected. That is called this confluent necrosis, or it can be bridging. Bridging means between two vital structures, either between two central veins of the hepatic lobule, that is called central necrosis, or between two portal triads, that is called portal necrosis, or between the central vein and the portal triad, that is called portal central necrosis. These three are called the bridging necrosis, or the necrosis which is much beyond this is called massive or the extensive necrosis. And point number three, inflammatory cell infiltrate. That means it can include lymphocytes, plasma cells, macrophages predominantly. Rarely neutrophils seen in secondary bacterial infections. Eosinophils are extremely rare. This inflammatory cell infiltrate is predominantly because of the underlying infectious agent, or it can also be because of necrosis as well. Because in necrosis, which is a kind of cell death in which the cell contents leak out, it will result in the attraction, that it will attract the inflammatory cells. For number four, there can be fibrosis. In chronic cases, fibrosis occurs because of the TGF beta secreted by the ito cells, which act like myofibroblast. This is all about this introduction, a brief introduction or definition of hepatitis. Let us see the etiology, that is the causes for this hepatitis, which is divided into infectious causes, number two, non-infectious causes, and others or the special causes. Under the infectious causes, there are most common reason being the virus, the viral like hepatitis A, hepatitis B, C, D, E. So hepatitis A, B, C, D are the most common viruses that cause hepatitis. These are called the hepatotropic viruses. These are called hepatotropic viruses. These are associated with strong association with causing hepatitis. Also, hepatitis G has been discovered in 1995, but this does not cause hepatitis. It is not associated with hepatitis, and interestingly, it is believed to be protective against. It is protective against HIV. It does not most of the time it does not cause an isolation, but it often coexists or it occurs as a co-infection along with hepatitis B virus or hepatitis C virus. So this is about the hepatitis viruses. The other viruses are the cytomegalovirus, Epstein-Barr virus, herpes simplex virus, varicella zoster virus, and the yellow fever viruses. These are the viruses associated with causing hepatitis. The non-infectious causes are alcohol. Alcohol is the most common reason for non-infectious form of hepatitis. So it is seen in chronic alcoholics. Alcoholic hepatitis seen in chronic alcoholics. Other reasons being drugs and toxins. Drugs like paracetamol and tubercular drugs like isoniazid and rifampicin. So paracetamol, tubercular drugs like isoniazid, rifampicin, they are mostly associated with causing hepatitis, and toxins like aflatoxin B1 seen in contaminated groundnuts. They are like known to cause hepatitis, and other reasons being the autoimmune hepatitis, that is immune mediated damage, and metabolic or genetic causes. Metabolic causes like Wilson disease or hemochromatosis. These are the metabolic causes. Genetic causes are the alpha-1 antitrypsin deficiency associated with hepatitis. Other systemic causes like the connective tissue diseases. Connective tissue diseases include systemic lupus erythematosus, SLE, and rheumatoid arthritis. And sarcoidosis, which is a granulomatous hepatitis. These are the non-infectious causes of hepatitis. The other reasons include ischemic hepatitis. Ischemic hepatitis, also called the shock liver because of hypoperfusion to the liver. Other is radiation-induced hepatitis. After exposure to the radiation, radiation-induced hepatitis can occur. And bacterial reasons for hepatitis. Under special reasons, the bacterial cause of hepatitis includes leptospira and syphilis. Leptospira and syphilis. And under parasitic causes, malaria and amoebiasis. These can also cause hepatitis. To roughly again let us revise the etiology or the causes of hepatitis, which is again divided into infectious, non-infectious, other causes. Under infectious causes, the hepatotropic viruses are hepatitis A to E, hepatitis A, B, C, D, E, and other viruses like CMV, Epstein-Barr, herpes simplex, varicella zoster, yellow fever viruses. The non-infectious cause, the most common reason is alcohol, seen in chronic alcoholics, drugs like paracetamol, and TB drugs like rifampicin, isoniazid, toxins like aflatoxin B1, autoimmune causes, metabolic causes like Wilson's disease, hemochromatosis, and genetic causes like alpha-1 antitrypsin, other systemic causes like connective tissue diseases that are SLE, rheumatoid arthritis, sarcoidosis. Other causes being the ischemic, that is shock liver, ischemic hepatitis, radiation induced after radiation exposure, bacterial causes, bacteria includes Leptospira syphilis, parasites like malaria, amoebiasis. These are the most common reasons for hepatitis. In our next video, we shall discuss in detail about acute viral hepatitis. If you like this video, please like, share and subscribe. Thank you.